I remember one of my childhood instances where I had, maybe I was in first, second standard maybe, and 1990s का time था, curfew था, and unaware of all these issues where reaching a doctor at that time would have been so difficult. Still, I'm jumping from bed to table to floor to again bed to table, and I suddenly had a fall and direct impact on my chin, which led to, I got a few stitches also. But I thought story was over there. It was taken care of. But little did I know that growing up, slowly, that jaw pain would keep aggravating and disturb my daily small activities, like simple activities like chewing, talking. There would be days where I'm in so much pain, or this entire muscle is so tight that I don't want to talk, I don't want to respond. And that time it was difficult to communicate because I myself couldn't understand anything. I always wanted to be a doctor, but I never knew which doctor. I mean, that time I was too young to understand all those things, so I always said I want to be a doctor. The entrance exams and everything happened, and I landed up being given the option of being a dentist, which was honestly not my first choice. I wanted to be a surgeon, but when I understood different branches in dentistry, when I read more about it, I kind of liked it because it has a creative aspect to it also. I am not a very logic person. I have some bit of creativity, so that gives me an opportunity to beautify those smiles, to enhance those smiles with the creativity that I can bring in, add on to the science which I like. So I pursued dentistry, and there were really good teachers who could inspire me. The head of department, the principal, there were few teachers which if I could name them, Dr. Sabita Ram and Dr. Nilima Malik, these were two people I was always very much in awe of. So carrying that personality, bringing that skill with that perfection, I learned from her and felt so good that I have such good teachers. And I aspired to be an oral surgeon taught by Dr. Nilima Malik. And since then, I always dreamt that I would want to learn under her. And destiny, as it has it did bring me to her, where she was the dean of my postgraduate college, where she was the dean, and I could learn under her all the surgical cases, all the cancer cases that were taken care of.
So with the profession I'm in, slightest tooth pain can cause a lot of distraction at work, and similar was the case. I was going through immense pain in my wisdom tooth when I got in touch with Dr.Deepika, and in a couple of days she just got me treated. Within one consultation my pain subsided, and I believe like 2 to 3 consultations she got done with my entire wisdom tooth related issue.
As a prosthodontist, I have a special ability to rehabilitate that patient, bring that patient back to society with some kind of self-confidence, and that made me feel more proud of the branch that I have chosen, that I am a prosthodontist. And I got the opportunity to learn from both my favorite teachers in the OT, where all those cancer patients are treated, and we are the ones who are helping those surgeons provide certain specific appliances which really help make life easy for the surgeon as well as for the patient in the rehabilitation part of it.
Something as small as a tooth filling, when I used to get it done from other dentists, you could feel that different feeling, a sensation of something there in your tooth for around 3-4 days or a week's time. But with Deepika, on the first day itself, I had no feeling as such. and I was living life like I have done nothing to my tooth or something. Another thing I would like to add about Deepika's clinic is she is totally up to date with her equipment. With up to date, what I mean is that she's got a one-stop shop for all your dental needs. You need not go anywhere. From a 3D scanner to anything that is needed in a dental treatment, she's got it.
So far, the journey has been really rewarding. Past 17 years from having worked as a consultant, then moved to my individual practice, and now expanded to have a multi-speciality clinic where we are able to provide more treatment options under one roof. A recent case that I remember, this patient had a jaw pain issue where moment she would talk, she would have a click click sound. Every time she would talk, she would have that, and even while eating, she would have that click click sound, which was so annoying that when you get even more conscious of eating or talking and lose context of what you're talking. So a simple splint device that we could give her, we could help her relieve pain, and the quality of sleep was improved so much. Then because we are multi-speciality, I could introduce her to Dr. Khanna, who's my sister and physiotherapist, gold medalist, who also comes in with that same empathy and compassion that I carry for my patient. I feel very confident of her collaborating with her.
Well, the best part of getting treated at Healing Hands is the extended support that you get here. During my treatment, there was one thing that was very strongly noticed, that I have a jaw joint problem, and this jaw joint problem is actually connected to all my joints, and which goes all the way down to my feet. And I unfortunately, due to a surgery at birth, I have a flat foot, and जिसकी वजह से at the age of 40 I have started to see the repercussions of it. And thankfully at Healing Hands, it's not just your teeth which are getting healed, your body joints are also taken care by a wonderful physiotherapist, Dr. Payal Khanna. The way she's able to understand the challenge, because a lot of times I had undergone some physiotherapy treatments, but it was not addressed to the root cause. So Payal was able to address the root cause. Also, the way she tells the exercises and the reason behind it कि ये क्यों करना है.
So we initially noticed some gap for some pain relief for some patients. They would still complain for discomfort and headaches, which radiated to the neck and often mimicked radiculopathy. This is where physiotherapy helped us in providing a complete relief, and that is when where we realized our team effort brought about a very positive improvement in the recovery and an overall significant improvement in their health.
A lot of times people just tell you ये आपको करना है और इसके आगे कुछ नहीं, but the reason behind it, and now in fact I am very mindful of when I need to rotate my feet, when I need to which side I have to move on, how do I get up out of the bed. These are small basic things which she has given me the insight on, not only healing but also as a lifestyle change, which will help me keep my body stronger and live a healthier life.
Simple common man or somebody from film industry, somebody from media industry, a model, everybody desires that kind of perfect smile. I had the opportunity to treat one such model who lay so much trust on me. Her words were, she was offered some barter as in their branding journey, where the dental clinic in some Western line could offer more to her, but she still had that trust and faith in me because I had done her teeth alignment work.
Hi, my name is Nikita and I've met Deepika I think 3 years back. I had issues with my teeth where I wanted to go ahead with braces. She guided me with the best guidance. After that, 3 years ke baad, she corrected my smile, everything. I was still not satisfied after the braces because I opted for veneers considering my profession. She's been very patient and she's guided me throughout. She's not been the kind of dentist where you do this, you do that. She's constantly told me this is right, this is wrong, and that is the reason I trust her a lot. After the veneers treatment, she's also been very patient with me because the kind of profession I belong to, I need a pitch perfect smile, and I'm very insecure about my smile because I face cameras almost every day of my life. So she's been very patient, and I'm extremely happy with the kind of service she's given, and I'm extremely happy with the kind of outcome I've got coming here.
Today people are really, everybody wants to capture their special moments. They want to remember their special moments, whether it is social media, Instagram, Facebook, whatever you say. And when you see those photos, that photo should not make you feel, "Arey, mera smile kaisa lag raha hai?" Ya, "Arey, mera..." Like for instance, one of my patient, she came down from UK. She had just day's time, and day after was her engagement. She wanted to have that confident wedding smile. The line that she said, "Photographer is coming to click my moments, and when I smile, I should look good." And just 2 hours of video work, and I could give that wedding ready smile to her. I remember she was smiling all day when she was leaving, and the wedding photographs turned out to be really good. I'm happy that I was part of that smile story where whenever she would look at those photos, she would remember me also somewhere, that yes, the smile work was done well.
Something which I used to love to do was travel to Bangalore, and while traveling to Bangalore, when the train stops at Pune, I used to have a lot of perus. We used to buy a whole lot of perus for the entire journey, and it's been almost 5 years that I'm not been able to have these amazing amruds. And after that, in the last 6 months, this thing is even aggravated further because I've not been able to have nice peanuts or ice cream with nuts, and my teeth is really giving a lot of problems. So, and that's why I decided that, so two main problems which I had was I had a bad molar. Actually, the molar had already broken. It was quite brittle. And because of that, there was a gap in that molar, and always food particles used to get stuck there. And the second problem was a really bad cap which was done by my earlier treatment, where there was now gap between two teeth, and that is why again food was getting stuck. So constant flossing every time after food was becoming too painful and too boring actually. So when I came to Dr. Deepika, she actually helped me extract that brittle molar, and it was quite an effort at her end because the molar was already brittle, so she could not hold it and pull it out. So which means she had to carefully remove it, at the same time ensure that jawbone was not affected, because I had my meetings going on, and I am an orator in these meetings, so I wanted to ensure that the swelling was not too much. So what she did was she extracted the tooth without impacting my jawbone, and ensured the right medication was given to me, both from a anti-infection perspective and anti-inflammatory perspective.
There has to be some emotional connect with the patient first. Only then the patient will open up to me. So if the location is close by, or if the age is such, or his persona has something which strikes a thought in my mind which I can appreciate, I'll start with that. Then in the medical history, I'm trying to rule out things which are going to affect my dental procedure. Every profession likes to expand their horizon in a certain way eventually by contributing back to the community, and the same applies to me also, where by way of seminars, by way of creating more and more awareness of what dentistry can really offer, whether it is with regards to jaw pain or with regards to the kind of accuracy that we can bring in when we are doing the digital smile makeovers, or when we are doing dental implants. Making people aware that it is not just crown and bridge dentistry today, it is not just a filling or a root canal that a dentist can do. They can really add a lot of value, face value, and lot of quality life to you, and that by way of seminars, by way of dental camps, or even teaching dental students. Whatever I have learned in past 17 years, I can precisely put that for the fresher dentists, so that they start their journey from there and go further beyond what we have achieved in as our generation of dentists.
May it be the simplest of the simplest toothache issue, or with regards to change in your dentures, which my granny had gone through, or with regards to finding out what exactly was the reason for my mom's left side pain. Dr. Deepika does a great job with diagnosis and at the same time in giving a foolproof solution to you. So I would highly recommend Dr. Deepika for the care and the amazing diagnosis that she has.
The final aspect of my career where I see myself in that hospital, where I'm able to provide wellness, rejuvenation, stress relief, basically entire holistic approach towards job pain management and taking away pain, improving quality of life for patients, where you don't have to really search for different departments all over the world. You have everything in one place, whether it is meditation, whether it is yoga therapy, allied therapy, along with all the dental treatments available to take care of whether you are a child or an elderly person, or you have had some cancer job surgery where you want to get the entire thing rehabilitated. A dedicated team of doctors available with the same level of emotion, compassion towards your pain, with the genuine desire that yes, the pain should go away and you should lead a very happy life ahead. That is where I see myself.
Getting your treatment done from Deepika is like having no anxiety at all, because any dental treatment gives you a lot of anxiety. So with Deepika, you're like nested in the best and the comfortable place, and she makes you feel really, really comfortable. That's the one thing that she has.
So when we go to a dentist, what actually comes to our mind is, oh my God, there are so many number of sittings that will be happening, and the amount of time you need to really spend with the doctor, and will we actually get a proper result or no. I think this was something which was actually put to rest in the first meeting with Dr. Deepika. She actually very clearly laid down the problems I had, and within my availability of time, she ensured that she gave me a complete 100% treatment within 4 to 5 sittings, and a complete recovery happened within a really short period of time, and that was something really amazing.
At the end of the day, what's really rewarding is that spark in the patient's eyes when you have really done a good work. You can see it in their body language. I mean, most of us as dentists, we are trained to just see the smile, just see the 32 teeth. But actually, if you are able to see the whole face, the focus in their eyes, I am sure any dentist can crack it and get the best work out of them. And this is what I feel happy about, that I'm able to read that language and create that beautiful smile. It helps me sleep better at night with that job satisfaction. And yes, I made some difference to somebody's life today, and somebody smiled because of me.